I'm very pleased to introduce our next speaker. He's a cardiologist, a geneticist, a researcher, and he's working to bring a new kind of medicine into widespread practice, and specifically designing treatments based on individuals' genetic structure. And this unique, innovative approach, combined with the latest in medical technology, opens up a whole world of totally personalized, tailored medical treatments, better care, reduced needs for hospital beds, and lower costs for everybody. Please welcome Dr. Eric Topol.
Thank you, David. It's great to be with you this morning, and we're going to talk about this biggest shakeup in the history of medicine. I call it the creative destruction because that really implies this radical innovation. Before I do that, though, I need to get a digital titer of this group, and I want to find out how many of you are active on Twitter. Wow. Okay, I didn't expect that because I've only seen about 5 people tweeting the meeting so far. So I guess you're just so spellbound that you're holding back on your tweets. Anyway, I get a lot of my best information from Twitter. If we all were part of that, we could all learn from each other a whole lot more. So this is kind of an old part of the digital era. This is a forklift loading up the first hard drive computer. Any idea what year that was? It's not too bad, 1956. And then this is the 40th anniversary of the cell phone. Okay, now let's go fast forward to where we are today. And we have these little devices, and we're just can't be without them. I don't know what people were doing without these little devices before they existed. So we have this whole series of 8 years going from iPods through smartphones, e-readers, and tablets. This changed our lives. And this has actually been a striking effect, and there's even a new species of man known as Homo distractus. So with Homo distractus, I tried to get a gauge on the effect that this has had, these little devices, and that's, of course, before they became and are becoming little medical devices. So I put out to the Twitterverse, our average attention span went from 12 minutes in 98 to 5 minutes in 2008. What is it now? And I got a very rapid response, actually from a physician in Ireland, and he said, "Sorry, what was the question?" So we know our attention span isn't too long, and it starts at a very young age, this whole phenomenon. And I thought that was young, and then I saw this, and of course that really convinced me it was particularly young. But that wasn't young enough, because then I found this. And most of this group are digital immigrants, and it's hard to take this whole kind of digital transformation of our lives, Over at the Junior Up, they could kind of get into this because they're the digital natives. So the other thing, of course, is part of this digital infrastructure, all of which is getting implemented in medicine and healthcare, are the social networking. You'll hear and have heard about this some today already, but this, of course, accounted for, in large part, the Arab Spring. This is the Egypt portion of that, and the whole idea is that the power of people is greater than the people in power. Just think about that as applied to medicine. So today we practice medicine on a population level. We have mass screening, such as mammography, which actually induces more net harm than it does good. And we have the same medication for all people with the same diagnosis, typically at the same dose. We don't recognize what we should be, which is the individual. We haven't had the tools to do that until now. And that's what's really so exciting, because we have a geographic information system, like what you see for a Google map in terms of satellite or traffic levels of information, but we have that for a human being. And it's extraordinary because what we have is a social graph, sensors, imaging, and then all the different omics, spanning from the DNA sequence genome all the way to the epigenome. I don't have time to get into all these levels, and even the environment, the exposome, which you just heard some about via Alan. So the social graph, just to comment first, because there's a lot more information from that source than what you might appreciate. And I know Mark spoke about this earlier this morning, but there's a phenomenal amount of information that you can get just from even, for example, Facebook entry, as Stephen Wolfram proved. And even from your mobile device, your phone, information can extract from, as shown in this Scientific American current issue, the data-driven society. So, for example, being able to capture from a phone that a woman is pregnant, doesn't even know it yet, just from the information that's being put in. So this has led to this whole point about Dad says you're monitoring all our phone calls. And Obama says he's not your dad. So we have a little problem here. The more you digitize, the more you are compromising, potentially, privacy. Now let's get into the sensors, because that's really a rich area. It's extraordinarily exciting, because we have sensors from head to toe. Every physiologic metric, whether it's through wristbands, Band-Aids, all sorts of things. And I'm going to show you a few, but I'd like to know how many of you use one of these Fitbits, Fuel Bands, one of these things here? Okay, not so many. I recommend them because they do help people get their 10,000 steps. I saw that David uses one, but they're good for people to get them more in motion. That's kind of where this whole field started as far as sensors, wearable sensors. But now we can have a blood pressure that connects to the a device that connects to the phone, or a glucometer that connects to the phone. But that's actually not that exciting, because there's a lot better things happening right now. So let me, if I can have you, I'll show you a glucose sensor that gets minute-to-minute glucose through this device here. And let's see if we can see that. This is worn on the abdomen or the arm, just underneath the skin. And then you just pull up on the app in the phone, you get your continuous every-minute glucose without the need of a finger stick. And this is what it would look like here. So this is a patient that can be monitored, and the glucose just after eating is a diabetic is 283, if you can see that. And then every minute it's updated, and then you can look at the trend, as you see here, from this meal, and you can look at 6 hours, 12 hours, and it's basically going right to the phone. So that's glucose passively collected on a minute-to-minute basis. Now, you can do a cardiogram on the phone, which is really great as a cardiologist to have my patients that can do a rhythm strip and find out if they have an abnormal rhythm or not. So let me just show you how that works. Just put your fingers on the back on these two sensors, and then in just a second, it'll show you my cardiogram. And it cleans up after a little bit here. There it is. Okay. All right. So that's what it's great, because then you can have a computer-read algorithm of your cardiogram, never having seen a doctor, and avoid emergency rooms and all sorts of things. So that's a big step in the right direction. There's even a credit card version of this you can put in your wallet or your purse. So as we go forward here, you know, how many of you have ever had to sleep in a hospital sleep study? Yeah, a whole bunch, because this is a common problem of sleep apnea. Why would you do that and pay $3,000 to sleep? Who could sleep normally in a hospital sleep lab? Well, why not for free just pop this device in your phone? And by the way, you'd want to turn the sound off, because otherwise it would be sound like an intensive care unit. You just tape this on your finger like this, and you'll see here in just a second, it'll show you my oxygen level in the blood, and it will also show my heart rate, and that sound you want to turn off, you know, because you don't want to hear every beep like you're in the ICU. So 99% sat, heart rate 67, you see. And now you can do a sleep study, because you know if your oxygen was dropping during the night, and you don't have to spend $3,000, you just do it through your smartphone. Okay. So there's a wristband that can predict a seizure before it happens. I'm just giving a sampling. There's just so many of these that have come up. There's a way to just use a smartphone to blow in the microphone and then get a lung function, so preventing asthma. And there's even contact lenses that can detect the eye pressure for people with glaucoma. This is even available in Europe. So then let's get to watches. You see I'm wearing a watch. I'm going to tell you about that in a second. It's not exactly a fashion statement here, but these watches are big right now for capturing information. And what I'm wearing is an intensive care unit on the wrist. And if I could have you come back up for just a sec. What this does is captures every vital sign. So here you see heart rate and the actual electrocardiogram. Then you get blood pressure and the actual beat-by-beat blood pressure measurements, oxygen saturation, all this stuff just through wearing what certainly can be miniaturized further someday, a big watch. So why would you go in the hospital when you can have all this monitoring done anywhere? And this is what it shows like on your phone. So you can check your email, surf the web, and have all your vital signs. If that doesn't induce hypochondria, I don't know what would. Now, there's necklaces to detect cardiac output and stroke volume continuously for people with heart failure that are coming. And there's socks for babies to get all the vital signs as well. It's just an unlimited proliferation, explosion of sensors, biosensors. So the phone, which you use for so many things right now, is going to be evolving to a whole different look for medicine. It'll be the hub of medicine. And it'll be used not just for these biosensors. I'm going to talk about scanning, the remote monitoring I just touched on. You can digitize pills. It's already FDA approved to know exactly about adherence. You can do lab tests through a smartphone, office visits, all sorts of things. So then we go to the next phase of sensor. Just when you thought it was already getting exciting. And basically, we have 400 plus sensors in each of our cars. It's amazing. We have over 10 sensors in our smartphones, embedded in our smartphones. How many do we have in human beings still today? 0 sensors embedded. That's going to change. And it's really, for the project we're working on, is to be able to predict a heart attack. That's not something we're able to do. And so people like Tim Russett or James Gandolfini died of massive heart attacks with no warning, in fact, even normal stress tests, because they only pick up tight narrowings of the arteries, not the mild ones, which are related to heart attacks. So we have been working on this very hard to isolate the cells that slough off the artery, lining the arteries that supply the heart muscle. And we found these cells that are very distinct, sequenced them, and now we have coupled that genomic signal with a nanosensor. And that nanosensor is a third of the size of a grain of sand. It can be injected into the bloodstream. And that will set up a heart attack ringtone warning. Hopefully, it won't cause a heart attack. And I don't know how many of you watched the Colbert Report here. But yeah, okay. So here's what Stephen Colbert thought about this. Can I get the sound?
A little sensor that we can put in your bloodstream.
Yes.
That will sense if you're going to have a heart attack days or a couple weeks before and give you a heart attack ringtone on your phone to warn you. Prevent the heart attack.
Really?
Yes.
Now there's information. I'm sure that it's going to come down the line that you know the insurance companies will say, hey, listen, we'll give you a cut if you have a monitor on you, so we can stay healthier. But then they're going to sell that information about your present health to other people, and I'm going to get like a ringtone that says, would you like 20% off on caskets? Or Crestor or something like that.
It's coming.
Yeah, totally wild. We're going to come back to him in a second. So you can do more than just a heart attack, blood under surveillance. You can use this for autoantibodies, for example, in type 1 diabetes, or for plasma-free tumor, cell-free plasma tumor DNA to monitor someone with a diagnosis of cancer, how they're responding to treatment. So that's really exciting. That's the next phase of sensors. You'll be seeing a lot more of that. Now let's just talk about scanning, because this is another way to digitize human beings. And so you can change a smartphone to do almost any aspect of the physical exams. It just pops on the smartphone and do, for example, an otoscope. And when I visited with Colbert, he had just perforated his eardrum. And so it was good to be able to examine his ear. So let's take a look at that.
I saw on Twitter that you had an eardrum.
Yeah, we're diving. I blew out my good eardrum.
I thought I could just take a look with the smartphone into your eardrum. Is that all right?
Okay, yeah, sure. I'll just stand. No,
No,
really?
stay right there.
All right.
So basically, I put this right in here.
Yeah.
And I hope I don't hurt you at all.
No, I hope so too. Ow?
That hurt?
No.
Okay. And I've got your eardrum right there.
It's an eardrum. It's not my ass.
I'll take.
By the way, could I get a colonoscopy with this thing?
And the scariest part is that the next day, 2 patients actually called my office to schedule a smartphone colonoscopy. So the stethoscope, that we've had for almost 200 years it's over for the stethoscope. It isn't even a scope, it's a phone. It doesn't look into anything. And so we have a device that fits in the pocket just as well, but it's high resolution ultrasound. It actually does scope in any part of the body that you can use ultrasound. So why would you listen to lub-dub of the heart when you can actually digitize the heart with high resolution ultrasound and get the same images as we've published as you get from the very expensive $300,000 machine in the hospital. And this is, of course, eminently portable, and the images can be sent wirelessly. So this is what the normal heart looks like, and here's a patient of mine with a very sick heart, and you can see the marked differences that you see immediately. This takes seconds to get these kind of images. And the fact that we have 125 million ultrasound studies in this country, and the fact that almost all these could be done as part of the physical exam, which would account for $80 billion of savings if we started to do that. That's just an example of the power of unplugged wireless medicine tools. So let's just talk about sequencing, because that's probably the most far-reaching, although a little bit further off in terms of actualizing its benefit. But we have an interesting problem. We have Moore's law, which of course has been tooling along as far as transistors per chip. And we have, of course, sequencing. It was the biggest triumph in technology of humankind in terms of the acceleration of sequencing technology and the cost. But on the other hand, we've got healthcare going in the opposite direction. We have not yet leveraged this phenomenal ability to sequence at such low cost. And so that will change. And this is just a timeline from pre-womb to tomb of how genomic medicine, digitizing the genome, will come into play. It's with a couple planning a baby or a fetus, a fetal screening in the first 8 to 10 weeks. You can sequence a whole fetal genome at that point from one tube of maternal blood. The newborn sequencing, undiagnosed disease, disease prevention, infectious disease, cancer, which is the mainstay of the treatment of cancer in the future, molecular diagnosis of any disease, the root cause, and then health span to promote that. So let me just give you one example of how sequencing changed the lives of this family. This family, the Grossmans, had come to Scripps. Lily had been confined to a wheelchair, age 16, all her life, although cognitively intact, lots of other neurologic problems. Her parents, Gay and Steve, had been to all these different hospitals and never had gotten a diagnosis, spent somewhere like $1.5 million for all this workup, no diagnosis. We sequenced the family, the trio, parents and Lily, got all the different data points. This is billions of data points to have to sift through. Ali Turkamani and our group did this work and was able to come up with the root cause of Lily's unknown disease. And that led to specific therapy, knowing this pathway, knowing this mutation, which has markedly improved her neurologic condition. You'll be seeing a lot more of this because this is really an exciting advance of using sequencing, just like in cancer. The fact is, in cancer, we can also do a GIS of the tumor. And that should be someday considered a likely standard of care, getting all the information you can to then derive the pathways that are the root cause of that person's cancer, since every single one is unique, and then get the precise line-up therapy. So we have a medical revolution that's brewing right now, and it's really particularly exciting. The smartphone will be the hub, and it will see you now. The robot will see you now. It doesn't sound that great, but underneath that is your doctor becoming obsolete. And that is a changed or morphed role of the doctor going forward. So a dermatologist, you don't have to necessarily see straight away. You can just take a skin a picture of a lesion and get a text with a validated algorithm as to whether that's of concern. Or eye refraction. Why would you go to an optometrist when you can have this done through a $2 disposable device and get your eyes refracted through a text, glasses made? Or, as I showed you, a child with an ear infection, that would all be done through your smartphone. And so these are big ways that the doctor is being squeezed out, the traditional role. And in fact, when your MD is an algorithm, this is a real change. And perhaps the most impressive case of recent times of a consumer, patient taking initiative was that of Angelina Jolie. And so she, of course, had this remarkable story of overriding her doctor's admonition not to get BRCA1 2 sequencing because of only her risk being a mother of ovarian cancer, and found out that in fact she had a pathogenic mutation and had a double mastectomy. She was in charge with information, basically digitizing relevant genes in her genome. And this Angelina effect is a great thing because what it's done is it's brought genomics to the forefront, to the public, and we need a lot more of that. We also need to change our ways from should patients get direct access to their laboratory tests. Why are doctors writing editorials like this? It's your laboratory test. Help me. And the AMA saying patients shouldn't have direct consumer genomic information, should go only through a doctor. That's not right. So even kittens like to have their own data. What about people? And the mantra ought to be nothing about me without me. And let the patient revolution begin. That's really where we're headed. So thanks so much for your attention.
Eric, thank you so much. It's massively heartening to see all this improvement in the standard of care that can be possible with the plummeting costs that go along with it. But let me ask you, now that we have this massive fire hose of data, what are the challenges in taming that data so that we know what to do with all of those layers?
Well, you're bringing up the bottleneck, which is the data scientist story. We don't have enough really skilled, not just in bioinformatics, but predictive analytics, because you can predict so much stuff when you have a real grip on the data. So that's, right now, that's a real limitation.
Okay. Thanks, Eric.
Sure,
Such a pleasure
sure.
having you
Thank
here.
Thank you.